Welcome to a special edition of South Today. We're live here at Worthing Hospital on the day major plans to change the healthcare for 500,000 people in West Sussex are unveiled. Now, I'm standing here in the accident and emergency unit here. I can tell you there's around about 8 people who are being treated at the moment and around 20 people who are waiting. Now, these plans will pitch 3 hospitals in a fight to decide which one becomes the county's only major hospital with a full accident and emergency department. This accident emergency department could go. It's also about mapping out the future look of the NHS with a new raft of community-based services. And it's not going to stop here in West Sussex. A similar review is soon to be published for Surrey. And government policy on emergency care means similar changes could be coming to a casualty unit near you. So after 18 months of deliberation, what are the proposals now being put forward? Well, our health correspondent David Fenton is just down the coast from me here. He's at St Richard's Hospital in Chichester. David, we had a flavour from you last night of the options. What's in the detail?
Well, Sally, the first point to make is that it's been decided there will be only one major general hospital in West Sussex, and these 3 options given out today are basically permutations on that, so let me take you through them. Option 1 says that Worthing would be the major general hospital, with St Richard's in Chichester losing its A&E, maternity and complex surgery. Haywards Heath would lose its acute services. Option 2 is basically a reversal of that, with Chichester becoming the major general, Worthing downgraded to a local hospital, and Haywards Heath still losing its A&E. Now, the third option again has Chichester as the major general, with Worthing still in the same boat as before, and Haywards Heath basically becoming a community hospital. So we have 2 out of 3 A&Es closing, maternity services moving to one single hospital. But, and this is a very important point, there will be new urgent care and minor injury clinics for people who are less seriously injured. There will be a new birthing centre somewhere in West Sussex, and there will be more paramedics and community nurses to treat people closer to home. Basically what we have then, 2 hospitals, both wanting to be the big hospital.
David, for the moment, thank you very much. Now, what's really got people like this one? It's the prospect of having to travel further for help in a life-threatening event. And earlier this year, Malcolm Nichols was brought into casualty here at Worthing Hospital after an angina attack.
Yeah, I came in today, I was getting very short of breath, a bit of chest pains. The ambulance got me here from Littlehampton, you know, pretty quickly, which is what, it's about 6 miles, 6 or 8 miles from where we were to get into here. I think if you had to go a lot further than that with someone who might have been perhaps, you know, more serious, then obviously make the journey a problem. You need this place and likes of St Richard's in Chichester. To take them away, I think, would be a bad move. I think this is probably one of the busiest A&Es in the area.
Well, Malcolm's here with me now. I'm glad to see you're looking much better now. And obviously you've got very good care here. If this wasn't here, how would you feel?
Worse. It would be further to go to get the right treatment as quickly as they managed it here at Worthing.
Because there is a possibility, one of the options is to lose Worthing as a major hospital. How do you think that will go down in the community?
Badly. Very badly. I mean, this area is expanding. Houses popping up all over the place, and they're thinking of closing the sort of main hospital.
So you've got more people coming into this area, and you say that you need a major hospital here.
Very much so.
Is there a fear, do you think? Would you have a fear? Would you be afraid if you had to travel a long way?
Yes, I think it probably would. I mean, particularly perhaps the elderly, who are, you know, obviously worried about their condition and, you know, family and friends and all that sort of thing.
Malcolm, glad to see you looking picture of health now. Thank you very much for joining us this evening. Now, NHS managers say the reorganisation is needed to provide services that fit with a changing society. So, are the doctors won over by the medical arguments? Let's talk now to Suzanne Brady. Let me bring her in. She's the A&E consultant here. I mean, Suzanne, what do you think of the options? You've heard some of them already.
I think we're extremely disappointed. Firstly, because there is only the option of one major general hospital in Sussex. and secondly because only one option actually has Worthing as the major general hospital, and I think there is clear evidence to suggest that there ought to be a major hospital in Worthing.
I mean, consultants were part of the sort of draft discussions before the document. Do you feel that you've been listened to?
I think the main issue is that we were presented with a model beforehand of one major general hospital, and what we would have liked to have been involved in is actual discussions over what sort of models for the future healthcare of West Sussex.
If Worthing was to go and the A&E department here was to go, do you think lives would be put at risk?
It could quite possibly be put at risk, yes.
And is that your real fear?
I think obviously we want to look after the patients in our local area, and a proper functioning A&E department is what is required.
I know it's busy in here at the moment. I must let you go. Thank you very much, Suzanne, for joining us this evening. Well, let's bring in the NHS manager who's got to oversee this process and help make the final decision. He's John Wilderspin. He's from the West Sussex Primary Care Trust. John, thank you very much for being with us this evening.
Pleasure.
Now, was this decision driven by the best possible care cover, or was it financially driven, as most people think it was?
Yeah, it was driven by three factors. The first was looking at the best possible clinical services into the long-term future. This isn't just about services over the next 2 to 3 years. This is about the long-term plan, what's sustainable over the next 15 years, and what's going to be the best in terms of healthcare over the next 15 years.
And also financially.
But to be fair, we also need to make sure that we're making the best use of our £1 billion budget, and we also need to make sure that whatever we plan is deliverable, is practical.
Now, I mean, it's an uphill struggle to get people to actually persuade people that there's going to be change, let alone go for different options.
Yep.
You really are fighting a losing battle with them.
One of the things that we contemplated, and people have asked us to do, is there a preferred option? Well, there isn't. We've come up with three options which meet, if you like, those three criteria: clinically sustainable, financially sustainable, deliverable. And what we want to do now is to get the views of the public about those before we make a final decision.
Are they going to be listened to, though, in truth? Are they going to be listened to? Because, you know, you're the professional, government are going to make the decision as well.
No, the PCT will make the decision. We'll make it with our colleagues in Brighton and Hove PCT, because this is about services which are interrelated. But we are embarking on a very extensive consultation process where we will have the opportunity to hear the views of people, but also talk to them about some of the concerns that they have.
And one of the big concerns is A&E. It's going to be a loss of A&E departments. Two of them are going to go. We're going to only have one.
Yep.
Now, you know, whatever the options, two will go. If my son has an accident in 5 years' time, and I think it's quicker for me to bring him to a major A&E, not in an ambulance, will he be accepted?
One of the things that we need to do, and one of the reasons that we're taking quite a long time to implement these changes, and therefore one of the reasons that we're actually planning them early, is that we will need to actually describe to people where they need to access their treatment. We understand that completely.
But people can't make that assessment, can they? If you're worried about a member of your family, you're
Yep.
scared, you're afraid, you don't
Sure.
understand, you will go to a major A&E.
Well-
Will they be accepted if they're not in an ambulance?
Yes, they will. Yes, they will.
That is for definite.
Yeah, if they go to the major A&E, then people will treat the condition, whatever the condition. What we need to encourage people to do is, where they don't need the services of big A&E, and many of the people that currently come into A&E don't, is that they can go to either a minor injuries centre, indeed to their GP, or to the urgent care centres we're proposing.
John Wilderspin, thank you so much for joining us this evening. I know we'll talk again in the next 18 weeks, so thanks very much for being here.